Recorded.
नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभं करिष्यामि प्रसन्ना भव सर्वदा. हरि ओम. Yesterday and day before yesterday we have seen different disorders, sports injuries, and commonly seen some arthritis or mechanical deformities related to hip joint. Hip joint is somewhat a complex joint where you can find a great role or scope for Ayurveda as a first line of treatment also. Only if you leave the surgical aspect, all the other things can be taken care of with the help of Ayurveda. So, the commonest thing which we see in hip is avascular necrosis of head of femur. See, in small children, we see Perthes as a disease. Perthes is nothing but say osteochondritis. We have seen this osteochondritis dissecans in elbow joint also. So this is a sort of osteochondritis only, just malnourishment of a particular area of bone, maybe mainly in the growth plate or surrounding area. So there are so many reasons for that. See, in case of say tibial tuberosity, it is known as Osgood-Schlatter disease. In case of say calcaneum, the tender heel pad, what we refer to it as, it is known as Sever's or SEVER, Sever's disease or Sever's disease. Like that, there are according to sthan or according to location, the name changes in this, but this is a typical osteochondritis. Mainly, it is related to growing epiphysis in children, in kids. Bony nucleus of the epiphysis that gets affected, and it is become say fragile, somewhat soft, and deformity takes place because of pressure. So maybe it is say crushing type, or it is like osteochondritis dissecans, or say these type of deformities takes place. Mainly it is temporary deformity. Mainly it is a temporary deformity, and it heals on its own. Many a times it heals on its own, but you have to give that particular joint rest, and you should not give undue pressure to that particular area. That is what is very much important. See, in case of Perthes, it is say osteochondritis of epiphysis of femoral head, and in this case, in this particular femoral head, it becomes many a times it becomes partly avascular, partly deformed, mainly because of it has a unipolar blood. There are 2-3 main arteries in which two gets blocked because of say trauma or because of many things. Yesterday we discussed the causes, but the main thing is it gets blocked, and it doesn't send nourishment through blood to that particular area of bone, that is head of femur, and bone gets softened, the bone gets fragile, the bone gets osteochondritis dissecans, etc. Due to, say, recurrent episodes of ischemia of head in this particular age group, maybe because it is associated with synovitis also, and first thing is synovitis, then necrosis, and the third stage is stage of healing, what we refer to. First stage is synovitis, second is necrosis of that bone, and third stage is healing of that particular bone. See, it may occur at the age of 5 to 8 or 9. I have seen these type of cases, and patient comes to you for an Ayurvedic treatment in case of Perthes. Only you have to give a good nourishment to the particular bone along with Tiktakshira Basti. Remember this. You can blindly follow treatment of Bhagna. You can blindly give medicines of Bhagna, say like Lakshali Gugul or Gandatel capsule, which works wonder in these type of cases. But along with that, please remember, try to use Tiktakshir Basti in these type of cases. Child presents with pain in hip, often radiating to the knee. So remember, in shoulder pathology, pain radiates up to the elbow. If pain is radiating to forearm or the fingers of the hand, then it is the pathology related to cervical spine, that is known as cervical disc syndrome. In case of hip pathology, pain radiates towards knee. If pain is going below or going downwards, then remember it is the pathology of lumbar spine and not hip related pathology is there. So that is the main thing. Maybe limping or stiffness is there. Say limitation of abduction can be seen in these type of cases. You have to think of shortening of leg, and accordingly we have to investigate or we have to examine that particular area. Sclerotic changes of epiphysis of femoral head is present at that particular area, at that particular head of femur. Hip joint space is increased in this case, and that is the main pathology in case of Perthes disease. We have to prevent the head from misshapening. When the bone is in softening phase, at that time we have to be cautious in treatment and we have to prevent its further damage like necrosis. We have to prevent that. So that is the main thing. It can be achieved with the help of physiotherapy also, along with good Ayurvedic treatment, efficient Ayurvedic treatment. So what can we do? Snehapan is the key in these particular Perthes cases. First go with Pachan. After Pachan, go with Shamana Sneha. In Shamana Sneha, we use Shirabala capsule, Bala capsule, or say Gandhatel capsule for that matter. Why? So, Saukshmat Saratvat for Vata Prakop, specifically of Sukshma and Sara, takes place. So, in that particular Dushti, we have to use Kshirabala 101 Kshirabala. That means we have to do Siddhi for 10 times, 50 times, 100 times, etc. So after that, it becomes more Sukshma, more Sara, which can chase Vat and which can control that type of Vat. So Kshirabala capsule will take care of these type of Dushti. Along with that, in Panchakarma, first Virechan, and after Virechan, we have to go for Tiktakshira Basti. We use many a time we use Rajayapan Basti also, Mausaras Siddha Basti also. We have given Guruchi Amalaki Siddha, Guruchi Amalaki Musta Siddha Gruta along with Tiktakshir Basti. That also we have used. Guruchi Amalaki Musta is Vishama Jwaragna Kashaya, mainly used for Chaturthak Jwara, that is Asthi Majjagata Jwara. So that can be used in Maharashtra. We do this type of treatment. Mainly we do Siddhi by Guruji Amalaki Musta of a particular Guruta, and then we administer that particular Guruta along with Shira, along with Tiktak Shira in this particular case. So this is the blood supply which gets hampered, and because of which we have to take care of, we have to treat the patient accordingly. So there are stages of, say, a vascular necrosis. Mainly it is because of loss of vascularity of part of bone, and that is the main thing. Maybe it is because of, say, fracture at, say, a trans-cervical area. If you get fracture, then maybe the possibility of AVN is there. There are many reasons which I mentioned yesterday also. The first is, say, alcohol, and the second important thing is steroid therapy. I told you yesterday also, we have got a new case of avascular necrosis where a female was given steroids for a longer period of time for her skin disease, and afterwards now she has developed a vascular necrosis of head of femur. Patient of dialysis also may get may get a vascular necrosis. So in case of, say, many anti-cancer drugs also, necrosis can take place. So these are some commonest causes of avascular necrosis. When the bone is getting softened at that particular time, if an Ayurvedic physician gets an opportunity to treat these type of cases, it is always beneficial for patient. But unfortunately, we get this type of patient at healing stage after, say, complete damage of that particular area of that particular joint. After that only we get these type of cases. to be treated. Uh, and so the prognosis is quite difficult in these type of cases. Patient complains of pain in groin and thigh, anterior side of thigh, and many a times these particular area, these particular say AVN is many a times it is bilateral. In around say more than 50-60% of cases it is bilateral only. Pain is every time pain is there. It may increase with exertion, but without exertion also there is pain. And in early stage x-rays are every time normal, but MRI can show some edema and say that's it. Mixed osteopenia with sclerosis is seen in second stage. Then it starts damaging the bone. The bone gets what we call a pitting type edema at a particular level. Cortical collapse can be seen, and afterwards all degenerative changes are seen in say head of at that particular area, head of femur. So these are some signs and symptoms which are seen in this disease. The gradation of this disease can be stated with the help of x-rays, which are very much important in this case. In stage 1 or in stage 0, what we can say, 1 only, in stage 1, there is no change in x-ray. But if abduction, internal external rotation and flexion, if it is painful in case of hip, then remember, my dear friends, please think of avascular necrosis of head of femur degree 1 and immediately start the treatment. Please rule out infection at the same time. Infection, and if there is no infection, then start the treatment as if the patient is developing avascular necrosis. And if you prevent his further damage, nothing like it. That is very important. Eventually, changes of osteoarthritis can be seen, and you can treat it. Afterwards, you can treat it as Sandhigata Vat of Vankshana Sandhi, Sandhigata Vat of say Uru, and then you can treat this accordingly. So that's it for say avascular necrosis. Avascular necrosis can be treated with Bruhan Basti, can be treated with Rajayapan Basti only. We use Rajayapan Basti, we use Mausaras plus Tiktakshir Basti, we use Gruta tail, that is Yamak Sneha plus Tiktakshir Basti in avascular necrosis. We teach the patient, we teach the patient or relatives of the patient, or we train them for Tiktakshir Basti. And in Maharashtra, we do it like this way. Just 60 ml of kheer, 60 ml of water, and say 10 grams or 20 grams of Tikta Dravya like Guduchi, Patol, Nimba, and along with that, we use Yashti Madhu as a drug of choice in these type of cases. And with this, we do Siddhi of that milk. Then we add 2 teaspoons of, that is 10 to 15 grams of Gruta in that particular mixture of say 60 ml, and immediately we administer the Basti as if we are giving Anuvasan Basti. At in the late evening, we administer this type of basti after having dinner. At around 7:30, patient has to take dinner, and at say 8:30 to 9 o'clock, after say 1.5 hours or 2 hours fast, then we administer this 60 ml basti along with Yamaka Sneha or Sneha, which whatever we use or whatever we decide. The whole night it will remain in his body, and then the very next day he can pass his stool, and the total basti is absorbed by the body. Many a times there is a patient doesn't complain of any loose motion or anything like that. It gets completely absorbed. Patient gets fantastic result with this type of simplest form of Tiktakshir Basti. It gives proper nourishment to all the bones in the body, and that's why in any type of osteochondritis, mainly in any type of osteochondritis, in any bone in the body, you can use this type of Tiktakshir Basti, which is very very effective in that case. So these were some diseases which we saw in our practice. These were groin muscle strain, lateral hip pain, hip pointer, injury to lateral cutaneous nerve of thigh, hip dislocation, and pain around pubic symphysis due to overuse and maybe due to fracture of pubic rami. That's it. So these are some commonly seen sports injuries. And hip issues as transient synovitis, hip, pyogenic hip, are rheumatoid arthritis, osteoarthritis, tubercular arthritis, Perthes, and in adults it is avascular necrosis of head of femur and snapping hip. These are some points related to Now let us come to some clinical tests which are very important and which can easily will take you to the diagnosis. This is Faber test, that is figure of 4 test, English 4. It is very simple, and it is to be done in case of lumbar disc syndrome also. Now in this case, patient the hip joint first is flexed, then abducted, FA, then externally rotated, flexion, then AB is abduction, then ERE is externally rotated. That is known as Faber. Flexion, AB, that is abduction, then ERE, that is externally rotated. So in this way Faber test is done. If the examiner is slowly lowers involved leg towards the table in this particular test. Now the positive test is one in which pain is produced in anterior hip. It indicates hip dysfunction. If pain is produced opposite to the affected leg, to the flexed, externally abducted leg, if pain is opposite to that, and at the posterior side, posterior level, then it is known as sacroiliitis of, say, if you are folding right leg, and if you get pain at left area, then it is then it is always sacroiliitis. If you are performing Faber test and patient gets pain exactly in the back, remember it is um, lumbar disc syndrome, that is spondylosis or degenerative disc lumbar disc syndrome. So Faber test is that much important in this case. In this particular test, if it is positive, pain is produced to anterior hip. This is hip dysfunction, of course. Pain in posterior and lateral side of hip is related to sacroiliac joint and lumbar dysfunction. So, one Faber test gives you 3-4 indications, 3-4 clinical signs and symptoms. So, accordingly, we have to treat the hip. This is known as hip test. Now patient is lying down, examiner is holding its distal tibiofibula and passively he is flexing patient's knee beyond say 90 degrees, and now the examiner is internally rotating his hip in this particular area, in this particular thing, if patient gets pain at hip joint, that indicates hip dysfunction. Pain in sacroiliac joint indicates sacroiliac joint dysfunction. So this is very simple test and you can differentiate it like sacroiliac joint dysfunction or hip joint dysfunction. So accordingly you have to treat it. Third one is buttock test. Now in this particular test, see how examiner is performing this test. He is doing straight leg raise. Then say if straight leg raise test is positive, then examiner flexes patient's knee a few degree and then he will try to flex his hip. In this particular test, if hip flexion it does not increase, hip flexion does not increase with knee flexion, which indicates that is bursitis or tumor or abscess or something mechanical turbulent or mechanical say obstruction is there, not dysfunction in say lumbar spine. Again I'll tell you, hip flexion does not increase with knee flexion in this buttock test. Then there must be bursitis or say any abscess or tumor like structure is there. Remember, and accordingly let the patient go for MRI. See, you can see what examiner is doing in this particular test. See, he is lying down, patient is lying down on uninvolved side. Now examiner is flexing patient's uninvolved knee enough, and now the examiner grasps patient's uninvolved leg with one hand, while other hand stabilizes patient's pelvis. Now, the examiner will extend and abduct involved hip passively so that thigh is in line with body and then adducts the hip. Now, in this particular thing, if high does not adduct. It indicates shortening or say sprain in iliotibial band, that is known as TFL, tensor fascia lata. This is one of the commonest injuries related to sports in many cases. So it is important. So first, let us go to some what we call it as treatment part, and then we can again come to say tests. This is known as score test. Now, involved knee is fully flexed. Examiner grasps patient's knee of involved side, and he is applying axial compression, that is downward compression, to patient's hip, and then scores femoral head around acetabular rim from point of maximal flexion, adduction, and internal rotation. In this test, if it is positive, crepitation and bumps are felt in smoothness of range of motion of hip. It indicates osteoarthritis of this particular joint. See, examiner is giving axial compression, and then say he is moving femoral head around acetabular rim with flexion, adduction, and internal rotation. If you are getting crepitation and bumps are felt in smoothness of range of motion of hip, then it is OA. So this is very important. Another one, see, you can measure the distance from anterior superior iliac spine to medial malleolus of ankle, and you can compare left and right leg. See, if it is unequal distance in left and right with this then it indicates short leg syndrome. That is short leg, not syndrome, but that is short leg. See, this is a very important test, and you can easily find it in your clinic only. Patient lies on uninvolved side with both the hip flexed to around 45 degrees. Examiner holds patient's pelvis with one hand and palpates his ischial tuberosity with other hand. What is ischial tuberosity? Where it is situated? Right now, if you are sitting on a chair, then your chair gets maximum. It is in connection with a particular area in buttock region. That particular area is ischial tuberosity. If pain is elicited on palpation, then it indicates ischial bursitis, very common clinical condition. So remember this. In this case also, you have to do both hips and knees are flexed. Now you have to hold patient's pelvis with one hand, and you have to palpate greater trochanter with other hand. Greater trochanter is at lateral side, completely laterally it is situated. In this case, if patient on palpation patient gets pain, then it is trochanteric bursitis, very commonly seen case. This is for piriformis syndrome. Very important, very simple test to do, and piriformis syndrome is very common. Many a times piriformis syndrome is treated as slip disc by many physicians. Piriformis syndrome is mainly musculoskeletal disease, mainly a pure form of muscular pain, and it can be controlled with the help of chikitsa of Mausagata Vat, very simple treatment. In this case, patient's examiner will flex patient's hip to 90 degree, and now he fully flex the knee also. Now, examiner will stabilize patient's pelvis with one hand, and other hand will push the knee downwards. Now he is pushing the knee downwards. If pain is produced in buttock, it is piriformis syndrome. Very simple to understand. Patient lateral पोजीशन में सोया है और आप उसके नी को अंदर की बाजू में ढकेल रहे हो. If patient gets pain, then it is piriformis syndrome. Very important test, sciatic nerve test. In this particular case, involved side, at the involved side, you have to flex it at knee joint. Examiner will palpate patient's greater trochanter. He will put his middle finger on greater trochanter and he will put his thumb on ischial tuberosity. And exact in between that, he will press firmly with thumb into soft tissue at midpoint between say greater trochanter and ischial tuberosity. The positive test is one in which tenderness is produced in sciatic nerve, which indicates, yes, it indicates herniated disc in lumbar spine, maybe piriformis syndrome, piriformis spasm, piriformis muscle spasm, or direct trauma to the nerve itself, which is very uncommon. So accordingly, we have to see what is to be done. So there are so many tests regarding this. So we will not go into all details of it. Now in this particular case, see, examiner is extending patient's hip over the edge of the table. Now it has come out and pelvis has begun to move. Examiner will grasp patient's lower leg distally with one hand and other hand over the proximal femur anteriorly. Internally, examiner will rotate patient's hip to end of range with distal hand and he will apply posterolateral pressure with his hand for say 20 to 30 seconds to stress that capsular ligament. If patient gets excessive movement is observed in hip joint, that will indicate instability of hip joint. So this is important. Then in this particular case, see what patient is doing. You can see this. See, in this case, it is extended, contralateral hip becomes flexed. It indicates fixed flexion contracture of hip. Fixed flexion contracture is we cannot treat these type of cases. I have not treated these type of cases. This is rectus femoris related test. Now this indicates tightness of rectus femoris muscle. In this case, if patient cannot do it properly, then it is tightness of rectus femoris test. In this case, one leg is passively flexed by the examiner, and a hip flexes simultaneously on side of knee, and this indicates tight rectus femoris muscle on that tested side. This is, say again, a tripod test. Now examiner is passively extending the patient's knee. Maybe because of, say, hamstring muscle contracture, you can feel it, the hamstring muscle contraction. In case of sciatic nerve problem also, you get this type of pain. So it is important. This is a straight leg test. In this case, you can see this patient is holding the thigh with both the hands, and in this case, if knee remains more than 20 degree from full extension, the knee remains more than 20 degree from full extension, it indicates, say, hamstring tightness. So in case of, say, trackers and everything, these people get this type of test positive. This is noble compression test, in which, say, involved knee is flexed from 45 to 90 degree, and you have to apply pressure with thumb to lateral femoral epicondyle, and up to, say, 2 centimeter or 3 centimeter proximal to it. While maintaining this pressure, examiner will extend patient's knee actively. In this case, if severe pain is produced over lateral femoral epicondyle at about 30 degree of knee flexion, this is known as iliotibial band friction syndrome or tensor fascia lata syndrome. Important as sports injury thing. Now this is, say, Trendelenburg test. In this case, pelvis on unsupported side will remain in position or actually descends. It indicates weakness of gluteus medius muscle on supported side. So these are some important clinical tests. Now let us jump to the main 3-4 important kalpa which we use in our clinical practice. That is, these 3-4 kalpa we use very oftenly in case of, say, avascular necrosis also, and you start using these kalpa which are very simple to use. In case we use these kashay very oftenly, and we give bharad or crude form of these kashay, and it gives fantastic result. Koranta is Sahachar, Eranda, Koranta, Nidigdika, Devadrum, Vishwa, and Lashun. ये उबालना है पानी में पहले, और उसके बाद पानी में उबलने के बाद छानने के बाद इसमें क्षीर मिक्स कर आपको इसका सेवन करना है. कभी कभी इसमें तेल डालकर भी हम पीने के लिए देते हैं. ये हृदय कुक्षी नाभि वृषण एवं उरुगत वेदना का शमन करता है. एरंड, सहचर, निदिग्दिका, देवद्रुम, विश्वा, लशुन, ये देने से क्षीरयुक्त कषाय इसका देने से उरुगत वेदना इसका शमन होता दिखाई देता है। एरंड, बिल्व, बृहदिद्वय, मातुलुंग, पाषाण भेद, त्रिकटु, ये त्रिकटु प्लस हिंगू and lavan and urubuk tel, that is एरंड स्नेह, is given, ये कषाय दिया जाता है। ये श्रोणीगत वेदना, अंशगत वेदना, पृष्ठगत वेदना, हृदयगत वेदना एवं स्तन रुजा का नाश करते हैं। सो एरंड बिल्वादी कषाय किसी कंपनी का भी है, वो मिलता है, और हमारे यहाँ इसका क्रूड फॉर्म भी यूज होता है। इट इज ऑल्सो अ सिंपल ड्रग। एक याद रखे, सिर्फ बहुत से जो नाभिगत वायु है या पक्वाशयगत वायु है या पक्वाशय के नीचे की चिकित्सा जब होती है, तब सक्षार, हिंगू, लवण एंड उरुबुक तेल, सक्षार, हिंगू एंड लवण is used in many कल्प। निर्गुंडी एरंडादि कषाय, निर्गुंडी एरंड, सहचर, गोक्षुर, पुनर्नवा, पंचकोल, अभया, कुलत्थ, पिप्पली is शिग्रु एवं कुलत्थ is used, और ये भी क्षार, हिंगू और लवण युक्त दिया जाता है। इसमें छानने के बाद, कषाय छानने के बाद इसमें क्षार, हिंगू तथा लवण इसकी एडिशन होकर फिर दिया जाता है। ये भी पक्वाशयगत वात पे, कटिगत वात पे, वंशणगत वात पे काफी अच्छा, उरुगत वेदना शमनार्थ इसका प्रयोग हम करते हैं। निर्गुंडी का प्रयोग और निर्गुंडी और एरंड का प्रयोग आप ऑल टाइप्स ऑफ लंबार डिस्क सिंड्रोम, वंशणगत व्याधियों में और जानुगत व्याधियों में बहुत अच्छी तरह से यूज कर सकते हैं। ये जो रासनादी कषाय है, रासनादी कषाय हम 3-4 अलग अलग यूज करते हैं और इसका काफी अच्छा रिजल्ट हमें मिलता है। एल्बो के वक्त, कुरपर संधि के वक्त भी हमने कंपैरेटिव स्टडी ऑफ रासना पंचक, रासना सप्तक, रासनादी, महारासनादी कषाय का कंपैरेटिव स्टडी हमने देखा हुआ है। विशेषकर जंघा, उरु, पृष्ठ, पार्श्व और रक्तज शोफ अगर हो तो उसे क्षिप्र, फास्ट रिलीव करने के लिए रासनादी कषाय का यूज किया जाता है। बट इम्पोर्टेंट थिंग इज घृत तैलाभ्याम पीतः प्रशमयेत प्रगे। ये घृत और तेल मिश्रित कर दिया जाता है और इसका काफी अच्छा रिजल्ट हमें मिलता है। रासना एरंडादि कषाय, इसमें रासना, एरंड, बला, सहचर ऐसे काफी अलग अलग द्रव्यों का यूज किया जाता है। ये कषाय भी सर्पी, प्लेन सर्पी भी चलेगा, या सिद्ध घृत भी, और तेल मिश्रित कषाय शूल युक्त वात का नाश करता है। ये कषाय जंघा, उरु, त्रिक, पृष्ठ, पार्श्व और हनु, शोथ और वातरक्त का वातरक्त में भी कार्य करता है। वातरक्तगत शूल इससे तुरंत कम होता है। रासना एरंडादि कषाय, रासना सप्तकम, इट इज वेरी वाइडली यूज्ड एंड ये रेडीमेड हम यूज करते हैं सांडू का, और इसमें रासना, अमृता, अरगवत, देवदारू, त्रिकंटक, एरंड एवं पुनर्नवा, और अलॉन्ग विद दैट शुंठी चूर्ण, ऐसा ये कषाय दिया जाता है। ये कषाय बहुत बार असाम अवस्थाओं में, वात व्याधियों में हम लोग देते हैं। जंघा, उरु, पृष्ठ, त्रिक एवं पार्श्व शूल का ये नाश करता है। माशादी तेल पान, अभ्यंग और बस्ती के लिए हम देते हैं। आप महामाश तेल या माश आत्मगुप्तादि तेल, इस तरह के अलग अलग तेलों का प्रयोग जरूर करें। If pain is along with compo, pain is along with wasting of muscle, pain is along with mausa shushkatam, then think of Mashadi tel as a drug of choice. जघन जानू रुजश्च सर्वाहा, माशादी तेल। इसमें भी आप इसमें लिखा हुआ भी है प्रकंपम, ये नस्यार्थ भी दिया जाता है, पानार्थ भी, परिसेचनार्थ भी ये दिया जाता है। इसका पीछू धारण किया जाता है वंशण संधि शूल में, उरुष शूल में। तो ये माशादी तेल एक अच्छा काम करता है। पंगु, अगर ये लक्षण दिखाई दे आपको, वंशण संधिगत आपको अगर पैथोलॉजी दिखाई दे और इसमें आप अजागृत का प्रयोग कर सकते हो। अजागृत ब्रूहणार्थ आप किसी भी इस तरह की मांसगत व्याधियों में दे सकते हो। सर्वामयांतक घृत, ये केरल की बहुत अलग अलग कंपनियों का मिलता भी है। ये मैंने थोड़े ही दिन पहले यूज करना चालू किया, ये यूज करने के लिए प्रवृत्त हुआ हूं। उरुस्तंभ, करस्तंभ, श्वास, योनिशूल, बस्तीशूल, रुजशूल, ऐसे अलग अलग व्याधियों में सर्वामयांतक घृत ये दिया जाता है।